Hey everyone, welcome back to the channel. In today's video, we're going to talk about something that's really important for everyone to understand: heart attacks. What causes them, how you can keep your heart healthy, and how to spot the signs early. Heart disease is the leading cause of death worldwide, but the good news is that there's a lot you can do to reduce your risk and take care of your heart. So, let's get started. First off, let's break down what actually happens during a heart attack. A heart attack, also known as a myocardial infarction, occurs when blood flow to a part of your heart muscle is blocked. This blockage is usually caused by a buildup of plaque, a mixture of fat, cholesterol, and other substances that stick to the walls of your arteries. Over time, this plaque can narrow the arteries, making it harder for blood to flow freely. But here's the dangerous part: sometimes this plaque can rupture, causing a blood clot to form. This blood clot can completely block the artery, cutting off the oxygen and nutrients your heart muscle needs to function. Without oxygen, the part of the heart muscle that is blocked starts to die or become permanently damaged, leading to a heart attack. Some key factors that increase your risk of having a heart attack include high blood pressure, high cholesterol, smoking, being overweight, and having diabetes. These factors can either damage the arteries directly or cause a buildup of plaque, which increases your chances of having a heart attack. Now that we know what causes a heart attack, let's talk about how to keep your heart healthy and reduce your risk. First and foremost, eating a heart-healthy diet is crucial. Your diet should be rich in fruits, vegetables, whole grains, and lean proteins. Foods like salmon, avocado, and nuts are great for your heart because they're packed with healthy fats. On the other hand, you should avoid processed foods, excessive salt, and sugars, which can lead to high blood pressure, diabetes, and clogged arteries. Exercise plays a huge role in heart health. Regular physical activity helps improve blood circulation, lowers bad cholesterol, LDL, raises good cholesterol, HDL, and helps maintain a healthy weight. Aim for at least 150 minutes of moderate aerobic exercise per week. This could be anything from walking to swimming or cycling. If you're a smoker, quitting is one of the best things you can do for your heart. Smoking damages your blood vessels and increases the likelihood of clots forming in your arteries. If you quit, you can lower your risk of heart disease and significantly improve your cardiovascular health. High cholesterol and high blood pressure can damage your heart over time, so make sure you're checking them regularly, either at home or at your doctor's office. If they're high, work with your healthcare provider to make a plan to lower them. Medication, diet, and exercise can all play a part. Being overweight puts extra stress on your heart, so maintaining a healthy weight is important for heart health. Losing even a small amount of weight can help reduce your risk of heart disease and improve overall well-being. Chronic stress is linked to an increased risk of heart disease because it can contribute to high blood pressure, unhealthy eating habits, and poor sleep. Find ways to manage stress, whether that's through meditation, yoga, or simply taking time to relax. Drinking too much alcohol can raise blood pressure and increase your risk of heart disease. If you do drink, do so in moderation. This typically means no more than 1 drink a day for women and 2 for men. Now, let's talk about how to recognize a heart attack. The faster you can act, the better the chances of preventing major heart damage. One of the most common signs is chest pain. It may feel like pressure, tightness, or squeezing in the chest. The pain might last for a few minutes or go away and come back, and it's not always a sharp pain. Sometimes it feels like discomfort. A heart attack pain doesn't always stay in the chest. It can radiate to your arms, especially your left arm, shoulders, back, neck, or even your jaw. Some people also feel pain in their stomach or upper abdomen. Many people experience difficulty breathing during a heart attack. You might feel out of breath or winded, even when you're not exerting yourself. Breaking out into a cold sweat without doing anything strenuous can be another sign of a heart attack. This happens because your body is under stress from the lack of oxygen in the heart. Feeling nauseous or lightheaded, especially when combined with other symptoms, can be a sign that your heart is in trouble. Unusual fatigue or feeling overwhelmingly tired can be an early sign, especially for women. If you're suddenly feeling drained without doing much activity, it's worth paying attention to. If you or someone else is showing symptoms of a heart attack, don't wait. Call an ambulance immediately. The faster you get medical help, the better. While you're waiting for emergency services to arrive, here's what you can do. Chew and swallow an aspirin unless you're allergic, as it can help prevent further clotting in the arteries. Stay calm and try not to move too much. Rest and breathe slowly. If possible, have someone stay with you so you're not alone. Heart attacks are serious, but understanding the risk factors and knowing how to keep your heart healthy can make a big difference. Eating well, exercising, managing stress, and avoiding smoking can significantly reduce your risk. And recognizing the signs early can save your life. Remember, if you ever experience chest pain, shortness of breath, or any other warning signs, seek medical help right away. If you found this video helpful, please hit the like button, subscribe for more health tips, and leave a comment below. Stay heart healthy and take care of yourself.